I think we can maybe just welcome everybody to the webinar quickly. Just give a few more minutes for the rest of the colleagues to pass through the lobby, and then we'll start shortly. Thank you. There we go. Good afternoon, everyone. Thanks for joining the webinar. We just wanted to do a brief update on the portal. I think we had also yesterday a session with some of the association members, and the intention then for today is just to granulate some of the feedback and give a little bit more detail in terms of the high level updates that were shared yesterday. So if you'll allow me, I'm just going to share my screen and the presentation quickly. I can just get that to load for us. Tukoza, just please do indicate or Mel as soon as you can see it and it's loaded. Hope it's pulling the correct copy. All right, great stuff. All right. So I think we just wanted to do then the update. So we quickly want to talk about the new releases that went in last night. So as of this morning, available then on the portal. Also just, I think, some general questions around missing application numbers or sequences, what to do. Also just to remind everybody just on how the uploading for that correct second proof of payment works, or where to do that exactly. Just the update on the questions and the queries that we had around indications. And then just very briefly also the process or plans for the rest of May as we then roll into June. So I think first of all, just on the new release, we have a Section 21 training video just to help applicants to create their accounts, specifically targeted to individuals that need to set up an organization account. And then under the organization account to also then invite additional users to then work as part of the organization. So this typically more to your hospital environment, where the hospital account org admin would then, as administrator, create the account and then add the different healthcare practitioners within the hospital, so that the pharmacy or pharmacist, clinical practice pharmacist, still then has line of sight of all of the applications on the organization account, and that the users can then do their applications individually. We also have created a downloadable checklist for the Section 21 applications, both the named patient as well as the multiple patient applications. And this will also be loaded onto the Section 21 applications view, where users can actually download the checklist. So before they start their application, just to familiarize themselves with the kind of information that will be requested during the application process, if there is any documentation that's required. And there is also on this checklist a few tool tips, just in terms of what information is to be populated, and if it's not applicable, what to do if it's not applicable. For the Section 21 as well, based on all of the engagements and feedback that we've received from various stakeholder groups, we also, post discussion with the senior management, have then adapted the fee calculation module. So there is very specific reason codes or reasons for applying for Section 21. Which now also, as per the updated guideline published yesterday, will then attract a 400 Rand fee per application, whereas then for the other reason codes and for named patient applications, it would then still be a 400 Rand fee per named patient application. So this change is also then live as of this morning. In fact, yeah, I mean, I just got off a call with one of the radiopharmaceutical colleagues who submitted his application, and we then obviously saw that fee calculation was working correctly. For I think probably more so the colleagues with health product applications, very important component that came through in the release this morning is just the option to do data correction. So where you are able, for each of the application IDs, if there is incorrect data or there's an incorrect sequence, we then have built a little function or module that allows you to, per application ID, export the data set or data attributes related to that application ID, and then make the adjustments on the downloaded Excel document. On the Excel document, there are also some references or reference tables. So specifically for the fields that needs to then be updated with very specific values, is to then copy and paste those values from the reference sheets, so that during the re-upload process, where you then upload the data back into the portal environment to then effect the corrections, it does then not fail validation. So very important that we just use the copy and paste function when we update the values for those that's linked to these reference tables, just to ensure then that the update is successful. So this would allow then our applicants to correct some of the information where previously a sequence had accidentally saved whilst the user might still be busy updating. And it's then moved it into the application manager view. This then actually allows you to make those changes without us necessarily from a support perspective having to delete the sequence and push it back down to legacy or draft. you're able to actually now effect those corrections yourself. Also, where an incorrect sequence was created, if you want to remove that sequence, to basically download the application ID, and then for that particular sequence that needs to come off, just to blank out the fields, and when you re-upload it, it then carries the only the remaining values back into the update into the system then, and drops off the values that are no longer on the Excel sheet. Right, so I think we do have just a short little video. I just want to show you quickly how this, where to find, first of all, this new exports module, the export import module, and just basically how it works. I will try and talk through it as best I can. It's a little bit new for me as well, so I'm hoping I get this right. Let me just start our video here. It's very tiny on my screen, but let's try and follow along. So just on your application manager view, you'll see there on the left-hand side now the export applications function. Here you can then search for your specific application ID. You click on the export button, and you basically then are able to download the export. So once you've downloaded the export, go. This Excel sheet opens up. You can just enable editing. And as you can see on the screen, this is basically then export of the application ID with all of the different submissions, related sequences, etc. And then all of the relevant data attributes. And as you can see at the bottom of the screen on the video, there's a number of different little tabs that sits on this workbook. So let me just start the video again. So as you can see there at the bottom, all of the different tabs for these reference values. And these basically then the data attributes that you can update, change, or then remove altogether. So just as an example, if we want to change any of the information, those first two tabs is where you would work. Okay, you effect your change. And as I said, just to make sure if you need to change something that you just copy the values and paste them to ensure that we then have the correct information passing through, and the re-upload of the spreadsheet then passing validation. Sorry, I'm just going to let this play. I think obviously...
A note, Christelle, sorry if I can chip in. Everything listed in blue, as you can see there, there is lookups in the rest of the sheet. So it's all the blue elements that has lookups in the rest of the sheet that can be edited. Everything can be edited, but that's the lookup indication. We just made it light blue to make it easier.
Thanks, Cornel. So I think basically, I mean, you can move through both those first two tabs and updating data. And I think once you're done, you can save your changes. And you come back and you click on the import button, select then your file. If there is an error, it will also then show you where the error is. As we said, there is the validation that would run. You would then need to just come back, correct the incorrect value that was flagged. And once you've corrected it, you can save it again, and then re-upload. Right. I think this next one, just a reminder around where to search for your legacy applications and just the various updates that is required as well to enable us to do the correct calculations based on the fee schedule or the algorithms that's been built to calculate then fees through the portal, through the automated process. Also done to bring about some time savings and some efficiencies, but really just quite important for us to have the correct input data in order for the calculations module to function. So this as well, you can either go search your application, and from there just, yeah, view the information, update the information. I'm just going to skip through this, just provide the updates. Sorry, I'm just going to move through this a little bit quickly. I think everybody's familiar with the process. So let me fast forward basically. Okay. I think this should all be familiar. Right. I think just some general feedback just in terms of the kinds of queries that we've seen or received so far under the portal support. There's some common themes. Just the question around now that FTP submission is running in parallel. For missing applications and sequences, may they be submitted through the FTP? Yes, we would definitely want to encourage that. If through review of your legacy data, you have picked up that there are missing sequences, as we started the exercise towards the end of January this year, where we published those sheets, and just asked applicants to do the sanity check. Also, if there were corrections to be done, that we follow the process to do those corrections, and then also provided the opportunity for us to start taking in those older sequences that were not on that spreadsheet, run them through the FTP submission process, and they were, of course, brought into the DocuBridge environment, and that allowed us to synchronize then the data from DocuBridge through to the portal. So if you have got missing sequences on the portal, it means that we also need to then resubmit that sequence via FTP, so that we can re-import the sequence then into DocuBridge as a clean sequence that is then compatible with the DocuBridge configuration. And that allows us then to resync that information for the particular sequence to the portal. This will be done as at the end of May. We will be bringing the databases back into sync. Obviously, there is quite a few submissions that we've seen come through the FTP portal, where those are coming through, whether there are variations or then some responses, which means that, of course, the two databases will then start running out of sync. And in order for us to then reactivate on the portal the take-in of variations, responses, renewals, through the portal, it's important for us to resynchronize, and that is then planned for Friday, the 30th of May, Saturday, the 31st of May. So I think just a note then, and we'll also share communication on Monday, that submissions, please, for the month of May, if we could kindly ask that they be prioritized and submitted then close of business Thursday the 29th, just so that we have an opportunity to go into static data sets on the 30th in order for us to run the extracts and just synchronize the data. So Thursday, the 29th of May, and then close of business, please, that means 4 o'clock that afternoon, just so that we then are able to take the snapshots in time and just bring those data structures back into sync. Also, I think for the questions or queries around indications, so I think one thing again, just to flight, there is quite a bit of information that we are collecting now through the applications process. And a lot of that is being used for data analytics. Some of it is being used also to assist the colleagues with the automation of some of the documents that gets created, like your certificate variations or your registration certificates. Some of it is also used when the variation summaries are produced. For us, including indications, it is as a request from National Department of Health supporting the NHI as one of the other entities within the National Department of Health, as the custodian basically of health product master data. All of the registered products in South Africa have their origin with SAHPRA. And as such, the NHI would also be looking at SAHPRA to provide them information with regards to the health products that's registered in South Africa. And one of the requests was for us to start introducing a standardized way of pulling the indications per product. The initial discussions with the NHI Systems Committee was around using MEDRA ontologies, and I think also subsequent receiving a number of queries, we had gone back and just confirmed whether or not it is not more feasible using ICD-11 as we do for Section 21 or then SNOMED ontology. So we have aligned on using the ICD-11 codes. So you will note as well that we have changed that field on the application screen. So we have multiple ICD-11 codes that may be selected for a product. And the label you will see also now reflects the ICD-11 code and not indication. We will still be using then the ATC class. We will still be using pharmacological classifications based on the regulations. And this is then augmented by indicating the ICD-11 codes. So as it then feeds into the health product, the healthcare regulatory system or record system, rather, I should say, for the NHI, that they are also able to start building the mapping tables for product to ICD-11 treatment codes. I think just a reminder for colleagues where a second proof of payment needs to be uploaded. Please do just remember you have to go into your application for then a particular submission where a payment was made at a sequence level. You will need to go back into your application manager, select your application, go into the submission screen, select also then the specific sequence, and you will remember that there is a little action button that you need to select on the right-hand side of the screen. And then when you click on that, also to then proceed to the option that says make payment. I know it feels counterintuitive because you've already made a payment, but that is the way that you access the screen for uploading proof of payments. So you'll go into submission, select the action, make payment, and that will take you through to the screen where you can then actually upload your proof of payment. It's important to follow that route or those steps just to make sure that the documents actually is uploaded in the correct place, so that the payment admin person can then actually view the second document in order for them to process the payment approval. Right, and I think then just some updates or some provisional feedback just for the activities for the rest of May. We did receive, as I said, had some engagements yesterday with some of the industry associations, and through them also received some consolidated feedback that was submitted by various applicants. And we are currently working through those 5 documents and just responding basically to the issues that have been captured in the sense that we're confirming whether or not those particular issues have been addressed in any of the prior releases that has been done. And also then identifying if there are still any remaining gaps or issues that we have not yet been able to correct or enhance, at least as per request. And this feedback will then be shared back with the different associations by the end of next week. So I think from there, we also, I think, indicated to the colleagues that joined yesterday, one of the challenges that we have around variations, and this is currently why it's running through FTP, is some of the variation codes were not on the code fee calculation table. And as a result, if a specific code was selected and there wasn't a corresponding fee on the table, unfortunately, the system would not be able to then produce an order form, and that's when we saw, a lot of the screenshots that we saw came back, and it was blank screening. And this is a result of the fact that the input table that was provided for upload, we did not have associated fees for all of those codes. So this has been extracted, it's been resent to our units just to ensure that all of the information is updated and that for each variation code, there is now a corresponding fee. And this is what we will be updating then next week. Once that has been completed, we will start doing some testing. For that, we will also put out a call for parties that might be interested in coming to do some testing with us online, so that we can also run it through different scenarios, make sure then that we have some volume that runs through the portal to ensure that it runs smoothly. All of the codes that we're expecting to see are there. All of the codes have got an associated fee. And of course, then that the order forms generate when you are ready to download your order form and make payment. I think the testing cycle that we have identified is in the 4th week of May, and this then largely to conclude testing on variations, responses, as well as renewal submissions. We would then want to reactivate specifically variations through the portal in a staggered manner. The proposal at the moment that has come from SAHPRA after some internal consultations is to look at rolling through the 1st week of June with the type 1A submissions on the portal, as well as all of the responses. In the 2nd week of June, to go live with the type 1B submissions. And in the third week of June, the type 2 and grouped submissions. Fourth week of June, we then reserve for taking in the renewal submissions. So as we roll on in a staggered way, week after week, that means that the submission for the 1As and the responses, for instance, on the FTP needs to move off FTP and by the end of the first week be fully running on the portal. And then in the subsequent weeks for the subsequent submission types, so that by the end of June, that we have all of the different application processes then reactivated and running through the portal. I think yesterday when we were discussing this staggered roll on, there was a request also for us to just have the discussion here today, just to gauge what the sentiment is. Some of the colleagues in yesterday's session felt that it might actually be better that we rather do testing the fourth week of May, first week of June, and that we then look at taking all of the variations and responses live then in the second week of June, which means that we will then bring renewals live on the third week of June, or otherwise we will do testing fourth week in May, first week in June, and then take all of the transactions live in the second week of June. So I think this probably is then something I can maybe just put to the colleagues on the call. They are welcome to weigh in on the Q&A and just kind of indicate to us whether or not we should rather do the staggered rollout or rather all processes at a specific point in time. It would be helpful to just get a sense of where the majority of our applicants feel we should be planning or targeting our planning. Ideally, we would want to also then have a firm plan for how we proceed for the fourth week in May and then in June by middle of next week. So I think your input on the Q&A would be quite helpful for us to arrive at a sound decision that has some consensus between the internal recommendations and then also the sentiment from the applicants. And that largely is covering then the update for today. I think the biggest topic that we just wanted to cover was the deployment of the export correction and then re-import functionality. I think this will definitely assist to address a lot of the challenges that we have seen come through the support desk. So we will, I think, continue to work on the tickets that have been received so far. Suffice it to say, I mean, there has been quite a large number of emails that have come through. I think we did mention this also in one of the previous webinars. And I mean, we are still working through some of those support requests that is coming through and trying to just feed back to each and every one of them. Some of them we know have been resolved already, but we are just trying to close the loop in terms of getting back to everyone. I think probably the one item I just want to call out is the release notification and that detail that we provide in terms of, you know, what has been deployed. That really is also quite important if you are not sure and we haven't been able to respond on your particular support ticket, is perhaps also to just keep an eye on that release notification center. So if a release comes through and it actually does tackle the topic or the theme that you raised through the support desk, then usually we have our releases going in on a Thursday. This is the routine that we have now settled into. On a Thursday afternoon, Thursday evening, we would push through any enhancements. So you would typically see also then on the Friday morning the release note to indicate what has come through and whether or not that may also then address your particular challenge or your particular issue that you've raised. The last thing that I just want to call out, the colleagues from the communications unit also reminded me just to make mention of this. I think in one or two of the industry association communications, they had also requested that we just confirm, the publication of the FAQ documents. So I think I just want to be quite upfront about this when I say at this point for me, compiling and consolidating the FAQ and just providing then I think some of the feedback on the FAQ document has not really featured on our top 5 priority list. I think my focus and attention has been on assisting the applicants, so either getting on one-on-one calls with either some of the colleagues in the industry or some of the members from the NDOH with their Section 21 applications, or other members that were doing Section 21 applications. So it has been quite a busy period, unfortunately for me, and really having bandwidth to sit with the FAQ document has not really been great, but it is something that we'll also endeavor to do and get out. But reasonably, I would rather commit to the end of May at this stage, and I actively encourage colleagues to please then go and look at the webinar videos again if there is anything that wasn't clear or anything that might still have been addressed during the webinar. Please just have a re-listen to the webinars and the Q&A feedback that we did at each of those. We will get a FAQ document out. But yeah, I think just in terms of everything that does need to get done, the priority is on helping people move through their applications and moving forward with their applications on the portal. And we would definitely will focus on the document. But I think for now, just if I can ask your patience on maybe prioritizing what we feel is a little bit more relevant and important to help people get their applications on the go. Then I think I can maybe just check, Cornel. I don't know if there's anything else you can recall if I dropped off something or forgot to mention something. Otherwise, I think we can just go to the Q&A section. And I can maybe just also
Still just to mention the import export tool is only available to the organization admins, just from a compliance stance, for them to take ownership, so they can download it and someone else can update the information for them to then re-upload. So that's just something to mention.
Okay, thanks, Cornel. Right, let me just go to the Q&A and we can try and see about colleague Solly, and also because we've got an hour, I'm going to try and focus on doing the Q&A via the Q&A chat. So please feel free to pop your questions in there. Let me just try and see if I can move all the way down and we can start from oldest to newest. Sorry, just bear with me. It's loading a bit slowly. Right, so there's a question around, will the application ID that is allocated by the portal remain unchanged even if the product moves from one applicant to a different applicant? Yes, the application ID is an attribute that will remain with that product for the rest of the product's life. So it's a unique identifier that will move through the different life cycle steps of the product. If there is a transfer of applicancy, it moves with the product or the application, the dossier. I know in certain instances we have a process where a master and duplicate might have been registered and it sits under one application ID. We have a very specific process where you then would delink, for instance, the duplicates from the master. So there is a function on the portal that talks to that particular variation change where we do the delinking. You would then delink the duplicate. What it then does from a portal perspective, it creates then a new application ID for the delinked components, and that then starts becoming its own little family that is then able to move to a different applicant with then that application ID, whilst the original application ID and the master might then be remaining with the original holder of certificate of registration. There is a question around, there's still no information on my company's account. I've registered and added my CIPC number. I think, Dale, if you wouldn't mind just popping your CIPC number in the chat. Once you've updated the CIPC number, we would need to then just rerun your import to import your data now that your account profile is correct. So if you could pop your CIPC number in there for us, we can then just make sure that your import is rerun. I see there's 3 comments. It looks like we've got maybe one other applicant that also needs to do that. Oh, okay. And I see Dale has actually put his CIPC number. So we'll capture that one, Dale, and then your other colleague from... Oh no, sorry. Sorry, Cornel. I see you've actually attended to that one.
We've actioned a few of them.
Lekker man, lekker. Somewhere on the go. I like it. Okay. And then we've got a question. Please provide an update on the new registration validation template for ECTD validation. Also confirm continued use of 2019 ECTD valid. Okay, I'm not sure if that is relevant to the portal. So I think this is a question more for HPA. I will pass this on to Pratibha. She can perhaps then just share communication out. Okay, we've got another CIPC. So that one from Kiara Health, Cornel. I'm assuming we managed to capture that one.
Yep.
Then how will we handle updates to registration certificates? Do we handle, i.e., issuing of addendum or updated certificate in the access? So, I mean, if it's a variation, it needs to be submitted as a variation. The variation will be reviewed, approved, and then the certificate variations will then be issued as a subsequent step. So it'll follow the normal variations process. There's still no information. Products video, okay. CIPC, got it. Another CIPC. Another CIPC. Should payments now be processed following the old process for second round responses? Yes, please. If you're doing a second round response, post the publication of the Gazette in February, the process then is to request or to make the payment and then include that payment in your submission. So if you're submitting via FTP, please then follow the old process prior to 1 April. How do we obtain the variation summary? So unfortunately, the variation summary is produced in the portal. So if there's a type 1A submission that you need to submit and you need access to variation summary, that needs to run through then the portal. So the variation submissions is still available on the portal for the applicants that then want to run their submissions through there in order to access a variation summary. Alternately, as I've indicated, the first week in June is specifically targeted at taking live type 1A across the board and phasing off FTP. So either we can do it now if you want to do your submission now, or you can then do the submission first week in June. But it is available and the variation summaries are currently being created in the portal itself. Okay, somebody having access issues. I'm not sure which organization you're from. If you can maybe just indicate which company you're from. Camentha, you've indicated just you're having access issues. So if you can just let us know. As I said, we have a really large number of tickets that we are still trying to get through. If you are at this stage still having a problem getting access to the portal, why don't you just pop your details, your email address, and your organization into the chat so that we can just try and help you. Okay, how long does it take for the imported sequence to show or reflect on the legacy? I think, Esther, if I understand the question right, so once you've imported then the changed or updated spreadsheet, it should show on the application immediately after the import has passed validation and has been imported. Cornel, I don't know if there's anything to add there, but I mean, it's, yeah, as you go through the steps and it gets imported, it shows.
Yeah, it's instant.
Okay.
Unless the question was that they can't see the legacy data, then we just need the CIPC number, but I'm not sure which way around.
Yeah. Okay, so there is a question from France just on the pharmacological classifications 21.13 not displaying. France, I've made a note of that. I will reach out to Dean. We did, I think there was another numbering correction we did yesterday afternoon quickly for another query. We can tackle this one for you and just make sure then that the regulations, we have actually done, I think, the sanity check yesterday afternoon, but it'd be nice just to confirm that the issue with 2113 has also been addressed. Okay. Is there a restriction on the number of times you can import data? Alistair, no. So, I mean, I think, you know, one thing we would then just need to note is once you've exported it, you then need to complete the cycle. So if you import it, let's say that's the first time. If you want to do it a second time, if there's maybe something else you want to change, you export it again, you change what you want to change, and you may re-import it again. There would be no limitation on the number of times that you have to make or effect a correction. Even if that is something where you may have only some data, you can do that as the first step. And if you later get more information, you can just, again, export that particular application ID, change then the remaining data and update again. I think it obviously would probably be advisable, you know, once you're ready and you've got everything, export it, change it, and then re-import it. But yeah, I mean, I do understand there may be some information that needs to come from somewhere else, and you might want to then run a second time. The export application tab is not yet visible on our company. So I think, as Cornel's also just indicated, it would then be the organization admin user that would have that particular option. I think if for organizations, you only have the one org admin, and there's maybe one or two more people that you then need to actually change to an org admin role as opposed to a user role, that then would also allow them to have access to that particular function on the application manager screen. Okay, if an existing product is not on the portal, can we create a new application to get the ID and upload the baseline and then import the rest of the sequences? If an existing product is not on the portal, so I think for Alistair, I'm just, I think, trying to understand. So the request is to, what is the process to submit the baseline, and then the subsequent sequences. So I think, yes, on the portal, it is to use the option for creating a baseline. If the baseline, meaning the application doesn't have an application ID, it would be for us to then create those new application IDs and build basically the application ID by specifying the different application numbers. If your application numbers are then, yeah, I'm hoping that we have them on DocuBridge. Alistair, maybe you know what I would recommend is, if won't you just please pop me an email with the application numbers that you're looking for. We are doing an inquiry for a response on the information received from GBMSA as well. There's 14 different application numbers that we are checking on at the moment. I don't know if any of those are yours. If they are, well, we will be checking those and reverting back to GBMSA. But if you're not sure, you are welcome to just pop me a mail, and I can just check with you whether or not we have them on DocuBridge, and we'll be able to resynchronize with Portal, or if there is a different process that we can then assist you with to get those applications and application numbers into DocuBridge, and then obviously sync back to the portal. Please confirm some of our products are still lying under incorrect applicant. So I think this is right. So I think for TOAs, I did also advise, I think the colleagues that attended yesterday's session, for TOAs, the process that we follow, receiving the variation gets reviewed. If it gets approved, it obviously moves through a different step to then do the certificate variation. So certificate variation is then issued, and on the medicine registration database, that gets updated. Unfortunately, I think the process that lags behind is the changeover of the application's attributes, and specifically then the update of the CIPC number. This is something also that we have found with some of the inquiries that we've received, is that the process of updating now the application ID attributes in DocuBridge is something that is lagging behind, and this is actually what caused the products to remain with an applicant that was the original holder of certificate registration, whereas the rest of the process moved forward. The variation was reviewed, approved, and certificate variation issued, medicine registration database updated. The component that wasn't updated was actually DocuBridge, and DocuBridge is the data source for us pulling into the portal. So this process deficiency is also then something that HPA has now addressed. So the update of the application ID attributes is then something that will run in sync with the rest of the process as the certificate variation gets issued. But for us to do the current correction, I think that needs to just please be flagged to us so that we can correct that information. It's important, I think, with TOAs that we just run through a verification process. That wouldn't necessarily be something that you would be able to fix with the export import. That is something that would require our intervention. So I think, Charmaine, yeah, if you have logged a request for that on portal support, what I'll do is just have a look at the mailbox and pull your query forward a little bit so that we can just fix those issues up. I think the TOAs where we've got old applications sitting on the old HCR, those ones, if there is any of the other applicants that also still have this challenge, please won't you just pop that into the Q&A for me as well, so I just know who to reach out to so that we can try and bring those through as priority tasks for us to address and fix, so that we can just get them sitting under the correct profile. and it matches, of course, then up with the medicine registration database and the updated registration certificates. Thanks, Romain. How does the portal distinguish between generating fees for second response reviews for major, moderate, and minor? So Annika, when the query gets logged or the query letter gets sent out, the unit, based on the internal guidelines and criteria, would indicate whether a query that is contained in the query letter is then classified as minor, moderate, or major. So when the portfolio coordinator then uploads that query letter, they indicate which category of the query is. And as then the responses come back subsequently, it would then pick up the associated fee. This again is something I think from a legacy data perspective, where the legacy data attribute, I think for probably about 90% of the queries that we had as open queries were categorized as moderate. So I think if there is a particular application where you're doing a second response and it's attracting a fee, which is either a major fee and you were expecting to see a moderate fee, or it's a moderate fee and you were expecting to see a minor fee, or vice versa, you can also then just give an indication to us, because we will need to update after confirming with the unit that, you know, for instance, a minor is the correct classification for the report, and that we then just update the data structure so that we can have the recalculated fee for the second response, that will then allow you to process your payment and proceed with your submission. So if the I don't know if you have logged a ticket for that, Annika, but if you have, I will try and find that also on the portal support ticket desk so that we can try and attend to that, and just get the confirmation from the unit as to what they classified it as. I think that also is something that I did raise with core technical team, is that they just start sharing with us as well the classification guideline or classification criteria, so that we can also then sense check that from HPA side as those queries get logged and the query letters get sent out. Please advise on the process to be followed to upload sequences that are missing on the portal. Trigger files, if required, will be inconsistent with specifications used when the old sequence is published. So Michelle, what we have for so the ECTD 2.1 had a ECTD 2.1 trigger file, and if you're submitting something that was in ECTD 2.1, you must just use the correct trigger file. If you're submitting something that came through from the 1st of November in ECTD 3.1, then please use the corresponding trigger file for ECTD 3.1. Okay. I think I've just answered that one as well. Some of our products have more than one presentation under one application registration. What should we select at container closure system if we have a vial and a single use pen, because we cannot select both? So I think for and this is maybe again a question I will have to defer to the HPA colleagues, because I understood with a vial being a presentation and a pen being a presentation, it's two different application numbers, that each application number should then have its own container closure system or presentation. Frans, I will need to get Pratibha to respond to you on that one. Sorry, my technical knowledge is a bit lacking in this regard. Okay. Right. I would love to say 48 hours is a good turnaround time on the support turnaround task, but as I've indicated, we are still sitting in excess of, I think, about 800 emails that we're working through. So there is a delay, and it's very difficult for me to quantify how quickly we will able to work through all of the tickets that are there. We are trying to get through that as expediently as possible. And a lot of the times we may not necessarily respond to your query, but we already picking up the issue and we're addressing it or have addressed it in one of the releases. And that's why I've indicated perhaps some of the issues may have been resolved. But if not, unfortunately, yeah, it is still taking us a little bit of time just to clear all of the number of emails that have come in. Does the resubmission of missing sequences on the portal also apply to those sequences that passed validation before the admin freeze? I'm not sure what exactly to answer, because I'm not exactly understanding the question. So if it passed validation before the admin freeze and you have a positive confirmation email from the automator, it is in DocuBridge and therefore it should be also on the portal list. If it's not on the portal list, please, if you could let me know. That would be somewhat of a strange anomaly, because all of the data that we had at the snapshot, and this was now after admin freeze, during that period where we were able to have the static systems to take the snapshots and import everything. If it successfully passed and it was in, it should be on the list. Not on portal, but is on portal list. Okay, that also doesn't make sense. It's not on the portal, but it's on the portal list. Okay, that's even more confusing. Can you please just pop in your email address, maybe also on the chat for me, please, please? I think I would need to reach out to you and just understand exactly what you're seeing, or what you're not seeing. Um, I don't know, Cornel, does that make sense to you? Unless I'm missing something, or
Hold on.
it's Friday, it's lunchtime. I might be having glucose drop. I don't know. It's probably a glucose drop. I'll just have to own that one. It's not on the portal, but is on the portal list. Okay.
Which was, yeah. Yeah,
Yeah,
if you
I'm
can have
not
more
sure.
detail, we can have a look at the legacy import list.
Yeah,
Yeah.
let's just have a look at the legacy import list. We've got the colleague is from Abbott. Okay, perfect. We will. I've got. Sorry, I just want to write down the email address, and then we'll go to the next one. Okay, the colleague from Abbott. We will be in touch so that we can just share screens and see what you're not seeing. Yeah, thanks. Um, while we use FTP, do we include the application ID? Yes, the application ID, please. So your submission folder needs to be the application ID, and in the trigger file, you must also use the application ID. Should we re-upload missing sequences via FTP? That has already. If it's not on the portal list, then yes, kindly submit the sequence through FTP. We have a product with only the baseline available, but none of the additional sequences migrated. Okay, not sure when maybe you submitted the subsequent sequences. If this is something that when the January list was circulated, that was queried at the time, or if there's already been work done on this or inquiries raised on this, or if this is something that has just been identified recently. perhaps I can just ask you as well if you would be kind enough to put your email address in the chat, so that we can just try and address some of these things that are coming up now. Okay, but I think by and large, if it's not in the portal, it means that we have an attribute that didn't come across from DocuBridge. So rather resubmit missing sequences via FTP so that we can then successfully import them into DocuBridge and resync back to the portal. That would be kind of like the running advice, unless you want us to connect with you. But I would sequences were submitted over 4 years. So I'm assuming they were still in CTD, and it might be that we would need to get those ones resubmitted. It's fine. It's the colleague from Amgen. If you, is it one application? Do you want to put in the application number for me, perhaps also in the chat? Raisa, if you wouldn't mind just popping the application number or numbers in the chat, or otherwise you can actually send me an email. Pratibha and I can actually look at that. So if you wouldn't mind maybe sending Pratibha and I directly an email, so that we can just connect with you on that. Good day, team. Thank you for, we tried uploading a new product submission, and application number, and invoice was generated. Day or two later, we wanted to upload the proof of payment. However, we could not reach the application number. Issues with, that's the one thing. Then second thing, issues with failed validation. So yeah, the issues with failed validation. So if the trigger file and the submission is not compliant with ECTD 3.1, if it was submitted as the ECTD 3.1, then it will fail validation. And you have to follow the normal process of correcting that and re-uploading on FTP as you did before 1 April. This is something to do with your submission and with your trigger file. For the issue around if an application number and invoice was generated, please just put in the application ID then, so that we can try and assist you. We wouldn't know where to look for the needle in the haystack otherwise, but it would be helpful if you can just give your application ID and just confirm that it did move through to the step where you've downloaded the order form, so that we can just confirm that we are picking that up or not picking that up. So please, if you could put your application ID in the chat and then just your email address. Please assist with a step-by-step on FTP upload. There is already a guide on the SAHPRA website. Do we still create ID on SAHPRA on the SAHPRA engagement portal? So if you're doing a new submission, you need to do the new submissions through the portal. We're not taking new submissions in through FTP. When you update the Excel sheet, can we add new rows for missing sequences? When you update the Excel sheet, can we add new rows for missing sequences, or do we just resubmit on FTP? Please do resubmit on FTP, so that we can take in the resubmission through DocuBridge and then resync those ones back to the portal. This is for correcting data that is on the portal, please. Otherwise, we're going to be one ahead on the one side and again one behind on the other, which is not an ideal situation. The data as well as the documents need to match on both ends, please. Yes, you can definitely delete the rows for sequences that shouldn't be there. Specifically those ones that were created, I think in the initial steps or initial phases of the portal, where some of those were created and then later stopped or abandoned. If you want to just delete them, you're also allowed to do that. And I know that I'm already 10 minutes past. Let me just try and see if I can do maybe one or two more and we can close it at 1:15. Can you provide an update on the anticipated timeline for implementing functionality that allows for the selection of multiple? Okay, so I did cover that in the presentation. Hi, how do we enter strengths for fixed dose? So I think the fixed dose, the FDC, the strength for each INN, that is available. So I think also for the fixed dose combinations, I think this is a really important thing for me to just call out, right? Because you are submitting in your ECTD dossier all of the information that would be going through to the technical units for the review. And this is really what the technical units see, is what in the ECTD dossier. The information that we're collecting on the portal is allowing us to do trend reports, dashboards, etc. So I think the main purpose of having the INN or the API, if you will, separately on our application screen is because there is a separate associated fee with an additional API to be evaluated for generic products or for products, well, specifically generic products, because in the base fee for an application, it usually is for 2 APIs, the price is set at whatever it is. And then for each additional API, there is an associated surcharge. That is why we were capturing the INNs. Okay, so for fixed dose combinations, it became obviously quite important for us to then know exactly how many INNs or APIs is in a product. So the strength as it relates to the product itself that needs to be evaluated by the units, it's more important for them to receive that correct information in the dossier. For us, we've enabled a field where you can capture then the strength per the INN on the current application screen. But that's basically all of the information that I need for now in order for us to calculate a fee. The rest of the information that you refer to, as long as that's in your ECT dossier and that's going to the technical unit, then that's what will be reviewed. From a strength perspective, on the second screen, we then have the process where you add the different strengths per line that needs to be registered. And the reason for us then separating out the strengths from the INNs is because there is a different surcharge that comes about for each strength. There is then an additional fee on top of the base fee that gets added on. And that is why we're asking for the strength to be added there. So it is driving fee calculations. But again, as I said, what goes to the technical unit that lives in DocuBridge, that gets reviewed and approved for registration, that needs to sit in your dossier. So what we need input on is how many APIs there are and what the different strengths are that belongs to this particular application, because it drives the fee calculation, the automated fee calculation. And again, just, with the calculation automation, it is to cut out that 15 to 20 day wait time that we used to have. We used to submit a request for an application number and for the fee. Whereas you can follow this process now, apply for it online, and through populating the different fields, we're able to then calculate the corresponding fee. You're able to get your application ID, and that can happen basically during that first few minutes that you lodge your application in order for you to then progress with preparing your submission. So I think that maybe is just an important thing to clarify and just contextualize. I think I might have mentioned it before, but yeah, hopefully it's just a little bit more clear now around why we are collecting certain information and what we're actually doing with it, from a portal perspective versus the required information that must be in the dossier for the actual technical review. Right, and I think I have actually now gone way over the time, and I'm just getting a reminder that actually I'm way over time. So I think for me now, let me then stop here. There's a few more questions at the top, but unfortunately we won't have time to get through to them. Again, the colleagues from comms will help us to just extract the remainder of the questions. And again, if these, what we can do is we can also try and cover these ones specifically for today in the feedback that I will share with the associations. And the other FAQ documents, as I've indicated, we will attend to those for the end of May. But I think these, because it deals with the current ways of working, I will endeavor to also give the feedback for these remaining questions then to the different associations. They will each get a set with the same Q&A then. Cornel, anything else from your side? I don't know if you picked up anything else
No,
that you wanted to
we've
call out.
worked through a few of the CIPC numbers. Anything we missed, we'll make sure it gets imported. There was one where we couldn't find the CIPC number in the legacy data, but we realized it was for, sorry, I just want to make mention of this. It was for Rural Health. We've got legacy data. The CIPC was just missing in this, wasn't available in the in the legacy data, so we can do the import, but we'll replace that and correct that. But yeah, thanks for all of this. A lot of the people that I could get to, we've already started the importing. So I think about 8 or 10 that we've handled in this session. That's all from my side. Thanks, Christina.
Perfect. Thanks, Cornel. Colleagues, thanks very much then. We are going to have to close the session. I'm sorry that we went 20 minutes over, but we thank you for your participation. And yeah, I think we will try and have another one of these after we've shared some feedback with the associations as well. Thanks very much, everybody.